So first I would knock on the door, and while I'm entering the room, I perform hand hygiene and introduce myself to the patient. Hi, I'm Danny. I'll be your nurse today. How are you?
Good.
And can you tell me your name and date of birth?
Megan Fecto. My date of birth is 5/3/2000.
Perfect. And I would confirm this with the patient's wristband. And this information does appear to be accurate. And before I get started on my bedside assessment today, can you just tell me if you're in any sort of pain that I should know about?
No pain.
Okay, perfect. So now that I know that the patient is not in any sort of pain, I'm going to start with my neurological assessment. The first thing I'm going to do is ask the patient if they know where they are, if they know the time of the day, that sort of thing. And do you know where you are?
I'm in Biddeford, Maine, at my house.
Okay, and about what time of the day is it?
It's about 7 p.m.
And what's the day of the week?
It's Tuesday.
Perfect. So the patient is awake and alert. They are oriented ×3 to person, place, and time. The next thing I'll do is check the patient's pupils. Perfect. And if you could just keep looking straight ahead for me. Okay. And follow the end of my pen light. Okay. The patient's pupils are equal, round, and reactive to light, and she accommodates appropriately. The patient's behavior and speech are also appropriate and clear. The patient does not have slurred speech. Now that I have done the neurological assessment, I'm going to check the cardiovascular system. To do so, I'm going to listen to the patient's heart. The first thing I'm going to do is listen to the patient's heart sounds, and I would typically do this under the patient's shirt in clinical practice. However, for the purpose of this video, I'm going to do it over the shirt. The first spot I'm going to listen to is on the patient's right side at their second intercostal space at the sternal border, and this is the aortic space. Next, I'm going to move over to the patient's left side and check to see on their second intercostal space for the pulmonic area. Next, I'll be moving down to the third intercostal space to Erb's point. Then I'll be moving down to the tricuspid area. Lastly, I'll move down to the fifth intercostal space to the mitral area. S1 and S2 are both noted, and she appears to have a regular rhythm. Can you put out your finger for me? I'm going to check the patient's capillary refill. The patient's capillary refill appears to be less than 3 seconds, which is within normal range. Next, I'm going to check the patient's pulses. And can you put out both of your arms for me? So first, I'm going to check the patient's radial pulses. And I'm going to compare them bilaterally. They are both regular, 2+, and equal bilaterally. Next, I'm going to check the patient's feet and her pulses there. First, I'm going to check her dorsalis pedis pulses. These are both equal bilaterally and 2+. Next, I'm going to check her posterior tibialis pulses. And these are both equal bilaterally, regular, and 2+. While I am down at the patient's legs, I'm also going to remember to check for edema. I'm just going to roll up your leg for you, your pant leg for you. And the patient does not appear to have any edema. Now that I've checked the patient's cardiovascular system, I'm going to move on to their respiratory system. Have you had any trouble breathing recently?
Nope.
And have you had experienced any coughing or sputum?
Nope.
Alrighty. Now I'm going to listen to the patient's lung sounds. And I'm going to listen to 3 points on the left and on the right, both anteriorly and posteriorly, and also making sure to assess the patient's right mid anterior lobe. I'm going to start with the apices. And take a deep breath for me. And another deep breath for me. Another deep breath for me. And another. Another deep breath for me. One more deep breath for me. Okay, and for the purposes of the video, if you could just turn around for me so that we can see. Now I'm going to assess on the posterior side. And deep breath for me. One more. And another deep breath. And I'm going to listen to the sides. Deep breath for me. And another deep breath for me. Perfect, thank you. And you can turn back around. The patient's respirations are regular and equal bilaterally. She does not appear to have any wheezing, rales, or crackles. Similarly, the patient's respirations are equal, they are even, and they are non-labored. They're also clear. Next, I'm going to move on to the GI system. So, have you been having regular bowel movements?
Yep.
Okay, and when was your last bowel movement?
7 a.m. today.
Okay, and if you had to describe it, would you say that it was soft, regular, or hard?
Regular.
Okay, thank you. And are you tolerating your diet?
Yep.
Have you had any recent changes in your diet?
No.
Alrighty, thank you. If you could just lay down for me with your head up there and your feet down there. First, I am going to roll up the patient's shirt. So I'm just going to roll up your shirt. My hands might be a little chilly. Okay, and I'm going to inspect the patient's abdomen first. It does not appear to be distended, therefore I am good to auscultate. I'm going to auscultate / listen to the patient's 4 quadrants. And the patient appears to have active bowel sounds that are regular. After auscultating, I'm going to palpate gently. And do you feel any pain or discomfort while I do this?
No.
Okay. Because the patient does not feel any pain or discomfort while lightly palpating, I'm going to do a deeper palpation with both hands. And any pain or discomfort?
No.
Okay, thank you. While I'm here, I'm going to notice that the bladder is also not distended. And you can sit up for me. Thank you. Moving on to the GU system, I'm going to ask the patient about her urination patterns. And when you urinate, what color would you say your urine is?
Pale yellow.
Okay, and do you have any pain or discomfort while urinating?
No pain.
And lastly, regarding your urination, is it cloudy or clear?
Clear.
Okay, thank you. So I also noted that the bladder was non-distended. While I've been doing this entire assessment, I'm going to move on to my musculoskeletal system. So first thing I'm going to do is have the patient grab onto my fingers and squeeze them. Okay, thank you. And if you could put your arms out like this and push against my resistance. Wow, you're strong, thank you. And if you can bring your knees up and push against my resistance, thank you. And please practice your range of motion with both arms going up and back down. Perfect, thank you. And the patient's range of motion does appear to be equal bilaterally. She also has adequate strength, and I do not notice any swelling. While I've been doing my entire assessment, I'm going to note that regarding her integumentary system, her skin is warm, intact, and an adequate color. I'm also going to check for her skin turgor by pinching, and it does appear to bounce back appropriately. The last thing I'm going to do is make sure that the patient is back in bed, however they would like. If you want to lay back down for me. I would make sure that the side rail is up, the bed is on the lowest setting, and the patient has their call bell. And do you need anything?
I'm all set.
Alrighty, thank you.